So we have different types of barrier and moisturizing creams. This happens to be a protective ointment. This is A&D. This is good for moisturizing. So once again, if you're going to use anything from a multi-use container, you have to put a little bit, keep it on your clean area, and put the container somewhere else. Now once we have this, we can now use a Q-tip or spatula to apply to the wound or to the skin. Because this one is particularly a moisturizing, you can rub it in with your fingers, but you have to put it in the ointment first for ensuring that there is no contamination and infection control issue. This all would then be thrown in the garbage. This is a type of skin protectant as well, but it is used if there's going to be a lot of exudate to the peri wound. Perhaps you're putting an advanced product on and you need to protect the peri wound from the exudate or drainage. This is a good product to use. Again, you would take it, put it into a container, put the container to the side, and then use a Q-tip or your hands, if they're clean, to apply to the peri wound. I like to use my fingers because it's quite a bit of surface area that we're trying to protect. And this is meant for protection from moisture. Perhaps it's an area of soilage like stool or urine. This will help to protect the good skin from getting too moist from bodily fluids. Product is Triad. It is good for debridement. It's a very thick hydrophilic type of dressing. Again, we would use it maybe on this black eschar here. So I will have to take a little bit, put it in my container, on my clean area, and put the rest of the product on the side so it doesn't get contaminated. We can now use this with a Q-tip or spatula onto this area because this is what needs to be debrided. This is safe to apply to the peri wound as well. Although it actually debrides, it also is a moisture barrier to the peri wound. So we would apply that, and you do want to have a significantly thick coating of this on the wound. If you so use santal, you can also for debridement, and also you can use honey-based products for debridement on that black eschar. But if you do need a nickel thick of thickness applied of those products, particularly santal, to create effectiveness. Santal also requires a moist wound healing environment in order to activate. So over the santal, we can use a hydrogel. We could use a moistened gauze, a saline moistened gauze, or some other ointment that you might want to mix. If you want an antimicrobial, you can mix it with gentamicin or mupirocin to help create a moist wound healing environment and apply that onto the black eschar. All of those need to be changed daily to every other day. This is a type of gel or ointment. This is particularly a Silvasorb gel. We're going to also show you how to use this one. This one's a little bit difficult to use, so I like to show again. You're going to put it into a sterile or a clean cup. Put it on your clean area there, and put the actual product here. And now take this with your Q-tip, and you can apply. As you can see, this particular product is kind of like it's a gel, but it doesn't stick very well to the surface. Sometimes it's a little bit difficult. The warmer it is, the easier it is to stick. You do want to create a good nickel to quarter size thickness over the area. So you can see I'm just trying to cover this one area over the bone. Again, this is probably not the best product to use over bone, but just to showing how to apply and use. Same thing you would do with ointments. If you're doing any kind of gentamicin, mupirocin, any antibiotic ointments, this is a bit too thick. You want just like more of a dime size thickness or less. Other examples we have of other ointments is something called iodosorb. It is a paste and it is made of iodine, cadexamer iodine. You can usually apply it to infected, very moist wounds. It will dry it out, and it is excellent for biofilm and excellent to get rid of multiple bacteria if it's a very highly contaminated wound. This is a type of honey dressing. These honey dressings come in ointments, they come in sheets, they come in collagens as well. This particular one is in a gel. Again, the same way we've applied other gels to the wound, you can apply this. It's helpful for debridement. It's helpful for an antimicrobial environment and a moist wound healing environment as well. This product is a duoderm or a hydrocolloid dressing. You can see this is a particular product. It comes like this. It's very thick, but it creates a moist wound healing environment. These are really only needing to be used for wounds that don't have any open surfaces, because if there's exudate, sometimes it gets too moist underneath. But you can put it, now this is like a DTI, a deep tissue injury, something like this where we're trying to protect it. You could use that, or over a bony prominence. You can apply that. It's kind of like a second skin over the area.